Hey everybody, Global Clinical Engineering Day, and I'm here with Fabiola Martinez, who is on the CED board and a good friend from Mexico. Good morning, Fabiola, and tell us about your role in clinical engineering in Mexico.
Good morning, Tom. Good morning, everyone. Happy CE Day. Well, I am a professor at the University in Mexico City, and I specialize on topics related to clinical engineering. I have the pleasure to say that over 25 years I've been working with a lot of college and hospitals, and recently in organizations, formal organizations in health, in order to support the activities of clinical engineers and to also support the activities of the professionals of health. Um, Mexico is a very special place to live and to work on. We have a lot of a big diversity of uh, uh, landscapes and people and cultures, and we've dealt with also a lot of issues about health. Um, Biomedical engineering has had a very interesting story in Mexico. We have over 45 years of having this as a professional career, and as a professor of one of the first universities that imparted this career, uh, I've seen with delight how my former students have become very profitable leaders on biomedical and clinical engineering. This makes me happy because I've seen the efforts has worked. Um, Now we are living interesting times, I think, in all over the world, and I'm not talking about COVID only. We've been through some changes in the organizations, and I can say that our field has been increased in presence and in importance. COVID-19 has proved us that we cannot live isolated. We need each other to deal with these kind of problems. And my college and hospitals have proved that the efforts are well rewarded in terms of patient safety. So I'm very excited about what we're living here in terms of the professional development of clinical engineers, and looking forward for the next years to come. Please, I don't hear you.
So Fabiola, I'll let you catch your breath for a moment. Great description of 45 years of clinical engineers in Mexico, and I know you've been training them for nowhere near that long, but because you're still young, but for a good while. I know the satisfaction of seeing your students rise in the field. So tell us a little bit about, overall clinical engineering in Mexico today, and uh, and what you see going on with clinical engineers, and in your society and with SOMIP.
Okay, well, uh, I have the privilege to begin working in the first the clinical engineering departments in hospitals in Mexico a few decades ago, and I witnesses how they spread over the country in the recent years. The presence of clinical engineers in hospitals and also in Ministry of Health has been very intense, and the work they do spread all over the topics, the most important topics on the decision making processes that has to do with the leaders on health minister. Recently, we have been how our college Lorena entered to the COFEPRIS, that is the regulation, the most important regulation organization we have in Mexico, and her job is very strategic for us and for all the decision-making processes. We also have the emerge of organizations, biomedical engineering, that had pushed the efforts locally in different parts of the country to support the professionals of health. I mean, we had this Mexican Society of Biomedical Engineering as our strongest organization. It has all over 40 years of presence here, and with a lot of success stories to tell. But this is not the only organization we have. Recently, we witnesses the creation of two colleges of biomedical engineers, one in Mexico and the other in Jalisco. The activities they do are aimed to professional issues, but also they share the concern about providing the students and the future biomedical and clinical engineers with the tools that they will surely need to develop the activities professionally. So these three efforts have been very intense and very strong to support our activities. At the universities, we also have been increased the presence of academic programs on biomedical and clinical engineering. This boom released in the last 10 years. We also have over 50 programs, academic programs, and they are spread all over the country. This is important because we don't need to push our students to move from their origin places to study. We move to their places and we can share the opportunities and the experience via remote streamings and conference and virtual classes. And this has been very enrichment for all of us.
So I've heard a couple things. I've heard, not only has Mexico been working on biomedical clinical engineering for over 40 years, and now you have thousands of students and over 50 academic programs. How has that worked in the time of COVID? I know you mentioned COVID briefly before, and I certainly applaud the effort. We had Ramses Galans, from Monterrey, who has, created a ventilator for Mexico. So innovation is really happening, but what's your take on clinical engineers in COVID-19?
Well, I think this is a situation that we share with all over the world. We had to take the bull with the horns, as we said, and deal with all the principal problems that arose in the first days. It means the patients that come to the hospitals and the biomedical engineers that lacked of supportive protective equipment. We had to deal with disorganization and some sorts of issues. And but we also have the solidarity of the college, and we try to help each other with protective equipment, but also with the support in the development of these projects on ventilators, but the conditioning of the clinical facilities to receive the patients. I've seen some of my colleagues how they did COVID and they recovered from COVID and came back to work. The efforts may be focused only on Mexico City, but this doesn't mean that the efforts are not on other cities in the north part of the country, the south. You said Monterrey, you said Guadalajara and Mérida and Puebla, Veracruz. Well, all over the country, we had the presence of our clinical engineers in the front of the COVID-19 fight, and it has not been easy, but we are strong enough and resilient enough to deal with this and to beat it.
Thank you, Fabiola. Any closing comments? I know you're the important distinguished professor, but I do like the little yellow rubber ducky over your left shoulder too in your office there. But
yeah,
no, any closing comments though for clinical engineers on Global CE Day?
Well, I'm very happy to be part. I'm very honored I'm happy to be part of this movement. I think it's time to make the 3-4 steps ahead and not only say we are here, but said what we do and how we can change the world from this field. I'm very honored to be part of the CUD board team. I'm honored to be led by you and by my colleagues all over the world. And in Mexico, well, we have a lot of things to do, and we are with the will of make our best to make the things happen. So, well, thank you for the time, and happy CE Day for all of you.
Well, thank you from a big, important country. You're one of the leaders. So thank you so much.
Thanks to you.
Bye for now.
Bye.